Everybody can qualify for a Medicare Advantage plan if you are on Medicare A and B and you live in the county, the service area that's offering the plan. All you have to do is apply. They can't decline you because of your health. Now, that's just regular Medicare Advantage plans. There are special Medicare Advantage plans that you have to qualify for. Not everybody can get them. The most popular being dual special needs plans. People that are dual eligible. They're eligible for both Medicaid and Medicare. And sometimes people call those Medi-Medis or D-SNPs, dual special needs plans. There are special Medicare Advantage plans that will wrap around Medicare and Medicaid. And you're like, well, I'm already on Medicare and Medicaid, and I don't pay anything. I don't pay a copay to see a doctor. Why would I want to buy a Medicare Advantage plan if I'm not paying anything? Because Medicare Advantage plans that are for dual special needs people have extra benefits that you're not getting with Medicaid and Medicare. So some of the most popular ones are transportation, grocery money, help with your utilities or your cell phone bill. There's on and on and on, unlimited amount of special benefits. What you're eligible for depends on your county. So if you see all those ads on TV and you're like, yeah, I want a flex card. Yeah, I want help paying for food for my service dog or extermination services or whatever you want. That may not be available where you live. It's dependent on your zip code. That's one of the things we do is we help our clients, we research what's available in your county. And we see if those extra benefits could benefit you, as well as keep the doctors that you're already seeing in your network. So there's some work that we do on the back end. But dual special needs plans for people that are on Medicaid and Medicare, can be extremely rich in the benefits. That's why they talk about it all the time on the TV. But they make it look like anybody can get those plans. They make it look like it's from the government. It's not. These are private Medicare Advantage plans. And you can only get these benefits if you reside in the county that's offering that plan. So those are called D-SNPs. Another type of special Medicare Advantage plan is called a C-SNP, a chronic need special plan. And that is because 2/3 of people on Medicare have several chronic conditions. And when you have a lot of chronic conditions, you have blood pressure and cholesterol and diabetes and macular degeneration, you got to see a lot of specialists. There's a lot of people working on your care, and you need help coordinating all that care because it starts to be overwhelming. So there are special plans for people that qualify based on their health. You can only buy those plans if you have a certain number of the chronic conditions. Now, every company offers different ones. Some companies don't offer those. And then some companies only offer it if you have heart conditions. And some are specializing in diabetes. There's different types of special needs plans. The benefit to you is they're specially tailored for you, for people with special conditions, to help you get more coordinated care. There's a third type of special need plan that you have to qualify for. It's called an institutional plan. And you get that by being institutionalized in a nursing home. It's only available for sale for people that are in a nursing home. So the rest of Medicare Advantage, anybody can qualify as long as you have Medicare A and B, and the plan is available in your county. These three special types of plans are the type of plans that you have to qualify for. I hope you found this video fascinating. If you did, please hit the subscribe button below. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment. If you have a specific question, always feel free to call us or email us at the Medicare Family.